Let us talk about polypharmacy. This is a common problem in old age, and it's defined as use of more than four or more drugs in an older person. There are some risk factors or the factors that contribute to polypharmacy: patient's factor, disease factor, and doctor factors. First of all, the disease factor. The patient may have multiple diseases requiring multiple medication, so multiple pathology. Patient factors, patient may not be well educated, and patient often has high expectation of having multiple medications. Then comes the factor related to the doctor. Oftentimes, doctor overuse medications without proper evaluation of their impact in the long term. For example, an 80-year-old patient taking bisphosphonate, this will not probably have that much benefit, or taking statins, probably not much benefit because he will not live long. So if possible, then stop those drugs. So overuse of the medication by the doctor, then lack of review of what he is already taking because he has multiple prescriptions. The patient often visits multiple specialties, and oftentimes there is lack of communication between the specialists, leading to multiple prescriptions and patient following all of them, leading to polypharmacy. And polypharmacy usually leads to multiple drug-related complications, drug-drug interactions, increased risk of fall, and increased risk of death. So what are the measures that we can take to reduce polypharmacy? First of all, we have to have medication review in every elderly visit or every visit of an old person, medication review. And in the medication review, we have to check how many of the medication are being taken, how many drugs the patient is actually taking. The patient and the patient's carer should bring all the drugs that he or she is taking and count the numbers. How many is he really taking, and how many are actually needed? If there is any side effect, if he is not taking any medication, and obviously assess for the indications, as I said, needed. So in the medication review, if you find a drug that is not needed, that is causing side effect, or the patient is not taking, then de-prescribe those medication, de-prescribe the medication. And obviously try to use drugs that have multiple effects. Rather than using two drugs, use one drug that has a combined effect.